following segment is sponsored by Ward MD Facial Plastic Surgery and Form Derm Spa. It can be hard to know who to call for specific beauty treatments and procedures. Dr. Ward and Dr. Iorio are here to break it all down for us. Doctors, thanks so much for being here with us today.
Thanks for having us.
Thank you.
All right, let's start off. I'm sure there's some people out there wondering, what is the path to becoming a facial plastic surgeon?
So I can answer this, considering I just finished, or I'm in the process. So you go to undergraduate school, do your typical 4 years, and then you have medical school or graduate training. That's another 4 years. Then you go into residency. That's variable in years, depending on if you go into a medical subspecialty versus a surgical subspecialty. Typically for surgeons, it's at least 5.
Okay,
so we did 5 years. And then you go into fellowship, which is a total voluntary year. Or 1 to 2 years, depending on what you go into. And that's just to get further training and diversity in your training, since you were with the same people for 5 years before. So I'm a fellow with Dr. Ward in my final year of training.
All right.
But I did not have to do a fellowship year. You can stop right after.
There you go. But you wanted to become even better at your craft,
yes.
Which I absolutely admire. And I'm sure there are so many women out there who are looking at you, Dr. Iorio, who are thinking, oh my gosh, I want to be her. I want to do what she's doing. What advice would you give to them?
So I would say the biggest thing is you can do it. So many females out there think that it takes, I mean, obviously all those years that I just spouted out, it gets close to about 15 years. So many women think that they can't have it all, that they have to choose a different path in life, but you really can do it. It's just, you have to know it's a marathon, it's not a sprint, and you can get what you really love. And then if you love it, it's not like a job. I don't feel like I go to work every day. I just absolutely love it. And find a female mentor would be the other thing early on, just to see what their advice is. But everyone in the field is so amazing, like Dr. Ward. They all push all women to strive to go as far as they can in the field.
I just feel like I got a motivational speech. That was absolutely beautiful. So let's talk about what are some of the differences between the different specialties. Because I know we hear a bunch of different things, so let's start with a facial plastic surgeon. How is that different from other things out there?
So a facial plastic surgeon means that we just do the face. So we do noses, we do facelifts, we do eyelids, we do hair. We don't do anything below the neck.
Okay.
So our area of focus is just that. And there's really, in the medical field, there's really 4 core specialties that do that. There's facial plastic surgery. Okay. There's plastic surgery, which they do face, but they also do body, you know, like breast, tummy tucks, that sort of thing, liposuction. There's oculoplastics, which are people who did an ophthalmology residency and then spent some time just doing eyelids. And then the 4th group is dermatologists, which, you know, dermatology, they do our skin checks, make sure we don't have cancer or other things, but they also do things like fillers and lasers and stuff like that. So those are really the 4 core specialties. And that's the type of training that I think most people want to seek out. Just people like Dr. Iorio, who they're voluntarily spending 15 or 16 years to learn this, versus like taking a weekend course where you're maybe taking a shortcut to be able to offer these.
Right, and you guys, shortcut, that's not even in you guys' vocabulary. You both are so good at what you do. Really fast, you have an upcoming event coming up. Tell us about that.
We are so excited to celebrate our 6th year out and about. I left the university 6 years ago to start my own practice, and we are going to have amazing giveaways like free Botox for a year, thousands of dollars of laser giveaways, and it's just really to celebrate our patients and celebrate them for trusting us and for allowing us to provide the care that we do. Because it's, Dr. Iorio's right, we don't work, we just have fun.
Perfect, and you guys really do care about your patients. That's one of the things that is so great about where you work, and I don't say this lightly, you are in the business of changing lives. Both of you, thank you so much for coming in today.
Thanks for having us.
Thank you.